When we talk about the family, we don't just sort of refer to the immediate family and relatives. We talk more about the local community in general, be it neighbours, professionals, teachers, etc. So what we're doing essentially is trying to take the focus away from the patient and actually showing appreciation to all those people that play such a major part in making that life a little bit easier for the diabetic patient.
And so how can one go about nominating someone?
Okay, so the nomination process is quite simple. Today in the Chronicle there was an article featuring the form and also information about what to do, so you can cut the form from there. But you can also go on our Facebook page. If you go to Diabetes Gibraltar, there's going to be the nomination form which is downloadable. Fill it in. You can also get it from the primary care centre, where we've actually got a table and a stand there, the diabetic clinics in the primary care centre, and also in the St Bernard's Hospital, and also at the Diabetes Gibraltar premises on Langmoor Road.
There are, of course, two types of diabetes. What are the differences between the two, and what symptoms should people look out for?
It is very important to distinguish between the two, primarily because the family plays a major role in both. So type 1 diabetes, which is also known as childhood diabetes, sees an onset in the younger years of a person's life. So a lot of children are diagnosed with this condition, and there's nothing you've done wrong or anything you can do to prevent it. And I think that's really important to understand. It's not about eating sugars, etc. It's an autoimmune disease. So where does the family play a role in it, you might say? It's all about understanding the symptoms, highlighting these early on in the sort of patient's transition, and being able to go and get a diagnosis early to avoid complications. The sort of things you look out for are extreme thirst, weight loss, frequent urination, and extreme tiredness as well. And for parents, for example, something they might notice is bedwetting, something which the child might be out of character, and it's not something that they normally do.
And I understand there are steps that can be taken to tackle type 2 diabetes?
Indeed, it's all the same. So somebody who's already been diagnosed with type 2 diabetes can still reverse the condition in the early stages, and it's purely done by a controlled diet and by an active lifestyle. And obviously, I'm not a medical professional, but they can seek advice from the general practitioner, who will then refer them to the diabetic nurses.
And with so much processed food in today's society, this is something that one should be aware of when it comes to diabetes?
Certainly. I think we start very early on with lunch boxes, and I can't stress enough that it's type 2 diabetes that we're trying to prevent. From the lunchbox to the sort of treats that we use for children as chocolates and sugar content. In fact, Diabetes Gibraltar is doing an awareness campaign around schools, where we're taking around how much sugar is in certain foods, and this is doing the rounds in local schools. So we aim to sort of increase that awareness.